Hi, welcome back to Twin Tuesday. I'm Dr. Joan Friedman. I've been preparing for an online presentation that I'm going to be giving about the emotional dilemmas of a twin pregnancy. And in my preparation for this presentation, it triggered a lot of old memories of my own personally and a lot of the moms that I used to work with when I ran a group for moms of twins. I'd say about 5 or 10 years ago. And I guess what struck me was I hope to be able to express to the people that I'm talking to about the importance of having a lot of compassion for women going through a twin pregnancy. Having gone through a singleton pregnancy and then a twin pregnancy, there really is no comparison in terms of, the anxiety, worrying about, being at higher risk, having many more visits than you normally do when you have a singleton pregnancy, and, being tested for a lot of things that you wouldn't have to worry about when it's a singleton. And it's just a very different experience and filled with a lot of stress and a lot of unexpected things that you worry about that you have no control over. And I'm talking about how, with these new ultrasounds, how this vanishing twin syndrome has become so prevalent that, in your first scans, there might be, you see two fetuses. But, in the second scans or the second trimester, it's not there anymore. And it's really an emotional experience for many people. And I don't think maybe people in the medical profession can really understand how traumatizing it can be. For some people, maybe not, but for other people, maybe for those families that have tried so hard to have a child or gone through infertility, that the idea or the hope or the expectation that there's two, and then, in the next visit, there's only one. I can only imagine that it must create so much kind of tension and also make you worry about the remaining fetus that's in there and how the health of that fetus is going to be. And what's not changed since I wrote my first book, Emotionally Healthy Twins, is this feeling that new moms of twins and dads have, which is it's just an overwhelming experience. The majority of women that I've talked to about it don't even remember the first 6 months or maybe even a year. It's just a blur because of the emotional, financial, and physical overwhelm that they feel taking care of two babies at one time. And of course, it gets better and it gets easier. And then, you face different kinds of dilemmas. But those first few months or first year with two babies is really, really difficult. So I'm hoping that my presentation is going to shed light on some of these subjects, and hopefully I'll be able to make an impact where other medical professionals can treat moms of twins with a little bit more dignity and a little bit more respect. Thank you for listening, and I'll see you next week.